Research Fellow at University General Hospital of Thessaloniki, Achiepa, in the Department of Cardiothoracic Surgery. I'm Editor-in-Chief of Journal of Psychiatry and Mental Health, and I am a General Secretary of Board of Directors and Ethics Committee President of Hellenic Neuropsychological Society. Now, let me introduce my city, Thessaloniki. Thessaloniki is the second largest city in Greece. Its nickname is the co-capital, a reference to its historical status of co-reigning city of the Eastern Roman Byzantine Empire alongside Constantinople. Thessaloniki is Greece's second major economic, industrial, commercial, and political center. It's a major transportation hub for Greece, not only through the port of Thessaloniki. The city is renowned for its festivals, events, and vibrant cultural life in general, and is considered to be Greece's cultural capital. Sorry, some technical problems again. Let me share my presentation. I have some technical problems, sorry about that. I will share my presentation for one more time. Okay. This is my city, Thessaloniki. It's a beautiful city. You should come when we have the chance. And these are the historical monuments of the city, which are by the sea. And now let me introduce my university. Aristotle University of Thessaloniki is the largest university in Greece. The main campus is located in the center of the city of Thessaloniki and covers an area of about 33.4 hectares. It comprises 10 faculties, which consist of 40 schools and one single school faculty. Aristotle University strengthens our role in the European and international knowledge community by building upon collective and personal academic achievements, enhances our visibility among the traditionally prestigious academic institutions all over the world by establishing long-term cooperation schemes at research, education, and training level. This is Aristotle University of Thessaloniki and now School of Psychology. Founded in 1993, the School of Psychology has a worldwide reputation for high-quality teaching and research. The school also provides students with theoretical and practical training directly related to the main field of study, aiming to prepare them for further study in disciplines related to psychology. The School of Psychology consists of 3 departments which coordinate teaching and research, implementing programs and activities that help faculty members fulfill the multiple roles. There is the Department of Experimental and Cognitive Psychology, Department of Developmental and Educational Psychology, and Department of Social and Clinical Psychology. Offers BA Honors, Master of Science, and PhD degrees. This is the School of Psychology, and now Achiepa University General Hospital, which is a reference hospital for COVID-19 patients in the city. This is me practicing in Achiepa University General Hospital. COVID-19, a novel coronavirus currently led to previously unknown COVID-19 pandemic. The clinical profile of COVID-19 infection ranges from asymptomatic infection to severe pneumonia, acute respiratory distress syndrome, and or subsequent multi-organ failure, myalgia, and fatigue. In addition to the lungs, COVID-19 may cause damage to many systems, such as the heart, the kidney, the liver, and the brain, as well as blood and the immune systems. According to Johns Hopkins Coronavirus Resource Center, global cases of COVID-19 are more than 400 million global cases, and the global deaths are more than 5 million. In Greece, the first case emerged on 26th of February 2020. We have more than 2 million cases, and now we have more than 24,000 deaths. This is the map of COVID-19 in Greece. The areas with dark color are more infected by COVID-19, and this is a map of Europe. COVID-19 causes pressure for the national health systems and implications for clinical management. Nurses and doctors at the front line, but psychologists and neuropsychologists have a very important role in managing COVID-19 patients. Psychological effects of COVID-19. The novel coronavirus pandemic rapidly spreads across the world and is inducing a considerable degree of fear, worry, and concern in the population and among people with underlying health conditions, older adults, and healthcare professionals. The psychological effects of COVID-19 pandemic include panic behaviors to pervasive feelings of hopelessness and desperation, which are associated with negative outcomes. The main and important psychological sequelae are increased rates of stress or anxiety, high levels of loneliness, depression, alcohol and drug use, and self-harm or suicidal behavior. Stress, anxiety, depression, frustration, uncertainty during COVID-19 outbreak emerged progressively. In addition, a great amount of distress, social isolation, and frustration are related to the consequences of COVID-19 pandemic. And COVID-19 leads to dysfunction of the brain, neurocognitive functioning of COVID-19 patients. Studies describe patients who suffer from COVID-19 have central nervous system symptoms in individuals affected by COVID-19, such as inflammatory central nervous system syndromes, encephalitis, cerebrovascular or confusion, altered mental state, headache, dizziness, impaired consciousness, ataxia, acute cerebrovascular disease, and epilepsy, sensory-related symptoms, hypogeusia, hyposmia. It's reported by studies that that course of the infection is mild or asymptomatic in about 80 to 90% of cases. Moreover, COVID-19 may cause damage to many systems and the brain. Studies describe patients affected by COVID-19 who suffer from acute central nervous system symptoms that can cause permanent cognitive dysfunction as well. Symptoms from central nervous systems are more common in older patients and those who have more underlying medical diseases with vascular risk factors such as hypertension, diabetes, or obesity. Hypertension and to be less likely to show the most typical symptoms such as fever and dry cough. This variety of symptoms have an important social implication and impact on patients, families, healthcare professionals, and society. Now our study, we studied 20 patients, 8 female and 12 male with COVID-19 with a series of neuropsychological tests at 3 months recovery follow-up. Their mean age was 49 years, their mean years of education 16 years of education, and this is the neurocognitive test battery that we have used. As you can see, we are assessed a broad range of cognitive functions as well as emotions. And the preliminary results show that females have better performance compared to men, and neurocognitive decline compared to healthy adults, as you can see by the graph. It's important that healthcare costs to be reduced for recovered patients' optimal neurocognitive functioning. Permanent cognitive functions influences independent living. Cognitive decline is an important problem for the patient and family, and also for the community. It causes major financial burden of medical costs to the family and health services, and impacts independent living and daily activities of patients. The cognitive dysfunction, which is limitation in cognitive functions, have an additional social impact on independent living of patients, families, healthcare professionals, and society. Psychological preventive strategies at the community level, such as implementing effective communication and providing immediate psychological services, will decrease the psychological and psychosocial impact of COVID-19 outbreak. It's important healthcare to focus on medical and psychological treatment for patients and families' optimal functioning. Neuropsychological outcome preserves quality of life and has important implications regarding future design of rehabilitation programs that contribute to better patients' outcome. And rephrasing what Alan Badley had told about memory, we say that perhaps the best way to appreciate the importance of cognitive system is to consider
What's happening?
Dr. Kalliopi is having some technical issues. She
I'm
joined
here
again.
now. Can you hear me?
Yes, we
Yes.
can hear you.
Did you manage to see my presentation or not?
Sorry?
Did you manage to see my presentation?
You
Some
want
of it.
it? Yeah, sure. If
Half of my you were able to see half of my presentation.
yes, yes, yes.
Do you want
We
me to
show.
share it again? I don't know.
Could
Because
you just show the, could you?
Share your rest of presentation. We saw your
okay,
half
because
presentation.
You just show the recommendation and conclusions, please.
the conclusions, okay. I'm so sorry about that. I don't know what's happening today. I don't know what's happening. Okay, just a moment. Okay, can you see my presentation now?
Not yet. We've got a blank screen. Yeah,
Yes,
conclusion,
now we
right.
can see.
Yeah.
Okay, our conclusions are that it's important that healthcare costs to be reduced, leading to recovered patients' optimal neurocognitive functioning. Permanent cognitive functioning influences independent living. Cognitive decline is an important problem for the patient and family and also for the community. It causes major financial burden of medical costs to the family and health care services and impacts independent living and daily activities of patients. The cognitive dysfunction, which is limitation in cognitive functions, has an additional social impact on independent living of patients, families, healthcare professionals, and society. Psychological preventive strategies at the community level, such as implementing effective communication and providing immediate psychological services, will decrease the psychological and psychosocial impact of COVID-19 outbreak. It's important that healthcare to focus on medical and psychological treatment as well for patients and families' optimal functioning. And neuropsychological outcome preserves quality of life and has important implications regarding future design of rehabilitation programs that contribute to better patients' outcome. And rephrasing what Alan Badley had told about memory, perhaps the best way to appreciate the importance of cognitive system is to consider what it would be like to live without it, as cognitive system is not like a single organ like the heart or liver, but an alliance of systems that work together, allowing from the past and predict the future. And we don't forget the major psychologist contribution against COVID-19.
Can I ask a question?
Of course.
Yeah, okay. All right. I agree with you entirely. Cognitive functions are essential for, especially for somebody as old as I am. Now, I need to ask you one question. Is there any irrefutable evidence that the cognitive impairment that happens after COVID can be halted or reversed by, I know medical treatment doesn't, but is there any strong evidence to suggest that the deterioration in cognitive functions following COVID-19 can be stopped, or even better, that the process can be reversed? Or is it just the containment of, managing the whole family and the social environment together with the patient to function together as best as can?
I'm afraid I can't hear you very well, but if I understand correctly, you asked me if there is a way to stop the neuro is your question? Yes.
Yeah. Well,
I mentioned it at my presentation. I mentioned that we see what's going on, and then second step is neuropsychological and cognitive rehabilitation program that many psychological and neuropsychological treatment. We have an enhancement of cognitive system, of cognitive functions, memory, attention, executive, verbal fluency. Of neurocognitive rehabilitation, there is psychological we have management of emotions with the patient and the family. Are you with my answer?
Yeah,
Because I
sorry,
can hear you very well.
the system is not working very well. The answer was broken up. Don't worry, don't worry, don't worry.
Any questions? Thank you so much, Dr. Kalliopi, for your talk and your time. Thank you so much.